is Melissa Southwick, and I am showing it to be 12 o'clock on the dot, so I will go ahead and get us started with our coronavirus update call for today, June 1st. Molly, I see you're on the call. Would you like to go ahead and do our introduction?
Yeah, super. Thank you, Melissa. Thanks everyone for being on the call. I see we have a lot of attendees. I wanted to, and also welcome to the month of June. Just when we got into summer, it decided to get chilly on us again, but that's typical. I was noting as I was kind of looking through the slide deck that we're going to be, sharing with you all today. The kind of theme that I saw going through it is just, the kind of ever evolving nature of things that we're dealing with right now with the COVID-19 pandemic, and it's clear how much we as the Sash administrative team are relying on you all out in the field, the Sash staff, wellness nurses, coordinators, to really be partnering with us and giving us, your thoughts, the ideas, the questions, the resources you've started to develop as you are facing the, ever evolving issues that are coming to you from your participants and from your panels. And it's, so number one, I just want to say thank you because, we all know that we've never done this before. We've never, been working our way through this type of situation and, going from, reacting and then starting to plan out how to phase back in. So we've never done this before. And your help and your ideas and your questions and sometimes challenges have been amazing. And I think you'll see in this slide deck that there's a lot of that in here, this kind of back and forth. And it's the only way we're going to keep doing this and keep improving and keep being ready for whatever is coming next, because there's going to be things that we're not expecting. So thank you very much for that. And I look forward to our discussion over the next hour.
Thank you so much, Molly. So as we always do, we will start out with a time for you to chat. Okay, can you guys hear me?
Yeah, we can now. Go ahead.
Great. So please take this time to chat in your questions, things that may have come up over the last 2 weeks since we talked, and things that you're hoping that we'll cover on this call. Some things that I know that we're going to cover are how do the state's reopen plans apply to our older adults that we are serving? Should we be asking new screening questions? And what's new on the COVID star page? So those are some things that we are definitely going to cover, as well as many others today. But if you have questions that you'd like us to cover, please chat them in as always. So looking at the numbers, you'll see a new thing on this. You'll see two new things actually on the screen today. I had added the percentage next to, I believe, the people tested last call, and someone asked me if I could add the percentage next to all of them, so I did. Some of them are, just hard for me to wrap my head around, like what does really 0.008% look like? But I guess it looks like 55 people in Vermont that we have lost. So the numbers are there. Some people may find it helpful, some people may not, but you can take a look at all the various numbers that we're seeing right now. I have to say, of note to me was the number of people tested in Minnesota and Rhode Island. Those are some very, very big and impressive numbers. So I think that they must have really grown over the last 2 weeks because it caught my eye. The other thing that you're going to see on this page is Jen Schulmeyer gratefully pulled out a number of whatever was in the COVID tab on PHL. And so far, this is what we have entered in there. And I'm not sure if these numbers are low because there's not a lot of people being tested in the population that we serve, or if it's because this tab isn't being used very frequently, but we wanted to share what we had, and we'll continue to do that going forward so that we can see sort of what these numbers on the screen mean for our SASH participants as far as we know through PHL. So we haven't done this yet, but I was really moved by the numbers that I was seeing this week, especially in the news. I tend to try to keep these calls down to business and really matter of fact because I'm a very emotional person and I would probably start crying otherwise. But this week I was just beyond moved. We topped 100 fatalities in the US alone and 300,000 globally, with 4.4 million people having confirmed cases of coronavirus. So I would like that we take a moment of silence and just honor those people that we've lost. So I'm going to go ahead and mute me now, and we're just going to take a moment of silence to think about those people that we've lost to this disease so far. Thank you very much. I know that we've lost at least one Sash participant that I'm aware of. There may be more. There may be some that we've lost that were impacted by coronavirus, but that weren't labeled as losses to coronavirus. I know that some of us on this call have lost friends or family, and I just wanted to take a minute to, to just honor those people. And now we're going to move forward with the call, which feels a little awkward, but we're going to do it. So Casey, you heard a really interesting podcast that led you to a YouTube video that led you to this. So I'm going to go ahead and let you talk us through it.
Thanks, Melissa. I would like to encourage anyone who is able to spend some time listening or looking at some of the information coming from Dr. Osterholm. He is an epidemiologist and the founder of the Center for Disease Research and Policy out of the University of Minnesota, and one of the lead epidemiologists who are informing government policy at this point. And so he has a website at the University of Minnesota, again, through the Center of Disease Research and Policy. He also has a brand new book out, and or actually I think the book has been out for a couple of years. So, but now it's getting a lot of press because he predicted this kind of scenario. So he has on his website 3 different scenarios, and as you can see, this goes through January 2022. So this is long-term scenario planning that he has put out there, and with different ideas of what might happen with the virus. And basically, without catastrophizing a whole lot, he's saying that he has no idea which one of these scenarios is going to happen. Could be somewhere in between. But what he's really encouraging is the only scenario that we need to be really planning for is scenario number 2, with this huge fall peak in the virus. And so as long as we plan for that one, we will be prepared for any of them. So that's kind of the worst case scenario. So I just wanted to reflect on that idea and encourage everyone as we're kind of really going back to work, getting back to regular Sash, starting to work on pre-COVID projects, getting back in, to be thinking about what worked over the last few months and what didn't work over the last few months, and in anticipation of potentially going back into the kind of situation that we've been in. So what worked for your panel, what worked for you personally, like what did you learn, and what worked for your participants. So do you have a participant who these last few months have been really challenging, and what can we do for that person to prepare for a potential going back into lockdown? Because that certainly could happen. And we don't know when or if, but if we're prepared for it, then that person will have a better outcome, hopefully. So just thinking about your COVID plans, thinking about what information you got from the DRO and from the admin team and what would be useful. And then both on the personal and on the participant level, what could be changed or what can we work on over the summer while maybe there is a lull, to prepare for any potential resurgence or second wave that could be happening. just checking to see if there are any comments that I needed to respond to, but I think that's everything I have for that slide.
Great, thank you, Casey.
Yeah, there is a question. It's, yes, Jody, it's Dr. Osterholm, and you did spell it correctly, Osterholm. And again, it's the Center for Disease Research and Policy out of the University of Minnesota.
And I shared the link to YouTube in the chat, and I will share it in the follow-up email as well. Thanks, Casey.
And I did want to just add to that too. Ann O'Brien is saying from the numbers that you shared a few moments ago, Melissa, that the testing is really still only less than 5% of the population. And one of the things that Dr. Osterholm is talking about is what percentage of the population has to get sick from this. And there's lots of different variations on that, but we're really at the beginning of that cycle of how many people need to get ill before this goes away. Oh. All right, you can go to the next slide, Melissa.
Thanks, Casey. So this is a new sign that we put together as a response to the questions for it at the last call. And it's basically just new messaging for the same message. So always wear a face mask, stay 6 feet apart, wash your hands often. And then there is the caveat on the right, because I know that in Vermont, and I'm assuming in other states as well, it's saying that if you're 65 and over or immunocompromised, you still should be socially isolating and staying safe at home. So people had asked if we could find a new way to put the message out that masks still need to be worn even as states are starting to open. And this is what we've come up with. It is on STAR, and I will link to it in the follow-up email as well. Casey?
And so there's been a lot of different guidance around face masks. The governor in Vermont is not mandating them. And so we were curious to kind of what's happening. I don't know what the mandate is in Minnesota, if there's a mandate to wear masks in public. And I know that some towns in Vermont have mandated masks for going into stores and for shopping. So that creates a lot of challenges for our participants. There are certainly, we've heard a lot in the news about mask police. So neighbors or the general public who are stopping people, kind of harassing people if they're not wearing a mask, and that is definitely going on, which creates challenges for our participants who are unable to wear masks, as we've talked about. There are certainly a lot of participants who are being model citizens and protecting others and wearing their mask all the time. There's others that are making an effort, but maybe not wearing it all the time or not wearing it correctly, or fiddling with it the entire time, so that kind of defeats the purpose. There are folks on probably every panel who are refusing to wear masks, and how to handle that. That's been something that's come up a lot on the wellness nurse calls, or how do we handle people who are refusing to wear masks. I know there have been some panels that are requiring participants to wear masks if they're going to meet with Sash staff, and how we handle that for these people, and also for those who medically or emotionally are unable to wear a mask. So face masks are here to stay for a while. They're definitely the new normal, and I'd love to see what's going on in the chat, because I can see there's a lot going on in the chat.
See, I've been reading through the chat, and so it looks like Diana Rule has put this sign up in her buildings and said that since, or something like it, that since she has, there's been a lot more compliance with wearing face masks in the building, so that it really did help. I think that's good to hear. Deb Paulson said that the governor is requiring face masks be worn in St. Paul and Minneapolis. Oh, I'm sorry, it was the mayors are requiring that masks be worn in public. And then Jody Velarde had a question, should they be isolating and staying at home? I guess I was unsure whether that is clear within the state 65 and up with health conditions as things loosen up. And Jody, we actually had a call this morning where we talked about this quite a bit, and there is, and I can put a link to this, there is language in the most recent governor's order that does say people that are 65 and older and those with certain chronic conditions especially should still be practicing staying safe at home. So I can send that link, and that's obviously Vermont specific, but I can send that link out with the email afterwards. And then Molly pointed out that the Vermont Health Commissioner pointed out today the efficacy of mask wearing to help prevent the spread of the virus. So it's still being talked about quite a bit. And Sarah Kudra asked for the link to the Digger article. It is on this slide, and I will include it in the email as well. And that was just talking about what citizen policing of masks has looked like so far. And it was Chittenden specific, but it was a very interesting read for sure. Okay, that was all of the comments so far, Casey. I'll move you on to your next slide.
Okay. So I've been thinking a lot about the hair issue. I'm not someone who attends hair salons, but definitely hearing a lot about that and how people are really clamoring to get back to their haircuts. And so thinking about how you look on the outside as compared to what's going on with our health on the inside, both for ourselves and again, and especially for our participants. But it's not what's going on with our hair that really matters, because that hair won't kill you, but untreated medical problems will. So this is just my little plug to keep pushing our participants to access healthcare, go to the emergency room, go to the primary care, or at least call them and get those nagging health conditions checked or addressed. Molly chatted and she wished her hair looked that good. Oh, okay. Okay, this is my slide too, right, Melissa?
Yes, it is.
Okay. And this speaks a little bit to what Jody was talking about in her question earlier. There is a lot of mixed messages for older adults right now. So everybody's hearing on the news, you can start to socialize, you need to be careful, but you can start going back out. And then always there's that little caveat, that little asterisk or message at the bottom saying, unless you're over 65. And as somebody pointed out in a meeting this morning, older adults are a huge part of our population, but they're not being addressed in the same way as the rest of the population. So even though we're not getting equal representation in some of this messaging. So there's a lot of mixed messages, and at the same time, there's a huge increased risk to older adults and people with chronic conditions because everyone around them, their family, their friends, are increasing their social circle. And it's increasing really exponentially. I know in my own household, just adding one friend of my child to start to come and visit adds all of their friends and all of their friends' friends and all of their friends' friends' friends. So it exponentially increases risk for our population. And for those who are still staying at home, there's even increased feelings of isolation because now they aren't the only ones. You know, a month ago, everyone was staying home. Now it's just people who are over 65. So being inside and watching everyone else go out can increase those feelings of isolation and for them. There's also a lot of peer pressure because neighbors are making different choices. So again, that can increase the risk, but people can also feel pressured either to go out or to not go out based on that peer pressure. So that's really challenging for folks. And then conflicts with childcare and work. So we have, as somebody just mentioned in the chat, we have a lot of our participants who do childcare or who take care of their grandchildren. And that's increasing their risk, increasing that conflict. And a lot of them either are employed or do volunteer work, so they have to make some choices around that, or potentially feel like they are maybe threatened to lose that position in some way because they have to choose between going back to work or going back to their volunteer position. As we've talked about a lot people are still afraid to access healthcare. One of my favorite quotes from this week was by a doctor who said, "We've done a terrific job of terrifying everyone," and we rightfully so in a lot of cases. But now people are terrified of going to seek healthcare, and that is causing collateral damage and people to die from other health conditions. And then finally, people having a huge challenge of figuring out what their own risk is. That, if you watch the news, you might think that if you stepped out of your house, you're going to get this virus. Whereas, and then you see the Vermont news, which some days has 0 new cases. So what is my risk of seeing my grandkids? What is my risk of going to the grocery store? And just trying to figure that out. I know I've had several conversations with my own parents about, can I visit and what's the risk? And how do I wrap my head around what that risk is, both now and next month, and what that looks like moving forward. I think I can see that there's a lot of movement in the chat, but I haven't read any of it.
That's okay. Thanks, Casey. I've been reading it, and it's really the third bullet, the increased feelings of isolation, as well as I think almost like an unfairness that's coming across in the chat. And I love all the chats. Thank you guys so much. Really, how do we message to our population that while the rest of the world seems to be kind of getting back to normal, you don't? And so I think that the chat has been fantastic to read through. And as always, I print the chat log afterwards and read through and make sure we've addressed everything. What I would say, though, is that in our call this morning, we really realized that the messaging coming out of the governor's addresses, as well as any kind of thing from VDH, doesn't talk so much about. It's always this little caveat at the end that says, if you're 65 and over or immunocompromised, don't do any of this stuff above that we just said you could do. So we're reaching out to Dale to see if there isn't a way that they can start expanding on that. What exactly does that mean? Is there anything that someone under this guidance of being over 65 could do safely? We need to almost give people something, or else they're just going to throw their hands up and not do any of it. So we are reaching out to Dale to ask about really addressing these questions that you guys are all putting in the chat right now. And we will certainly keep you posted on anything that we find through those efforts. I'm not going to read through all the chats because it has been robust, but I so appreciate it. I've currently read all of them. So we did send out at Cathedral Square, we sent out, this is a sample of the letter to participants about new office policies as we reopen. And it does talk a bit about some of the things that have been coming through in the chat. Close contacts. So we are asking visitors to sign in when they enter our buildings. And there's a sample there of the visitor sign-in log that's supposed to help with sort of contact tracing within our building. We also recommend that people themselves are keeping contact tracing logs. And we've got it on here that we are going to be reopening outside spaces slowly. And then there is one of the comments that, if you choose, your responsibility, your choice, to have 1 or 2 close friends or family visit, there's some guidelines here. So please do not spend time in public hallways or lobbies. Do not use the inside public spaces. Please have them go directly to your apartment, have them wear a face mask in and out of the building, and consider your safety and the safety of other residents when trying to decide to invite someone over. So we will share these in STAR after the call. Feel free to take them and make them your own. And I do think it addresses a few of the questions that came in on the chat, but definitely not all of them. So we will continue to work on that. Casey, did you want to talk to us about screening questions?
Yes, so we've had a couple of conversations around screening questions, and this is definitely a work in progress. A lot of the VNAs have their own screening questions, and there's other models out there. Certainly, we need to be screening people before we visit them, and screening ourselves as well, and asking if there are symptoms if they have symptoms of COVID-19. One of the challenges is that these screening questions are changing frequently as they discover new symptoms. I think there's still versions out there that ask, have you recently traveled to China, which of course is at this point irrelevant and not even possible. So this is the current CDC guidelines, is that if they have a new onset of cough or shortness of breath or difficulty breathing, that's certainly a positive. They would screen positive for being at risk to have COVID, and you would need to have the appropriate PPE before you did any visit with this person. And I believe for the most cases, we wouldn't visit somebody who screens positive. And then at least 2 of these symptoms, which I think is really interesting, 2 of these symptoms, including fever. So just because somebody has a fever, that does not correspond, according to the CDC, to a positive COVID-19 screen. If they have a fever and chills, if they have a fever and a headache, if they have a fever and a sore throat, then that is considered a positive screen. So we're going to be working on putting together screening questions for Sash visits, but certainly those might come from your employer as well. So hopefully this will come out in the next email update next week is the hope. Any questions about that?
I see none in the chat. They're all still talking about the log for tracking.
Okay. Right. I did see a question on how high a temperature, and I'd have to look that up, what the current guideline is.
Last I heard, it was anything over 100.
But the important thing, of course, to remember with these questions, for example, with temperature, is a lot of older adults don't have a temperature even when they're very, very sick, so because of the way their body responds. So these are just screening questions, and of course we'd be screening ourselves as well. So if we have any of those symptoms, we wouldn't be visiting, or we wouldn't go to work at all. I wanted to share this Sash team resource guide that Ann O'Brien and Sarah, sorry Sarah, I'm spacing on your last name, that Sarah put together for Allard Square. And they put a huge amount of work into some scenario planning for the nurses, and also a resource list for their own panel. And on the next slide, there's a blank template, but we wanted to share this and encourage panels to put this together because it took a lot of time. And having this put together ahead of time for an outbreak in your panel or an outbreak in your building would be hugely helpful. So some of this is going to be across the board for any panel. Like, for example, if a participant doesn't have a PCP, you would call 211 for a referral, to get a referral for testing, or the health department. I believe that's the same in Minnesota, but I am not sure if 211 works the same way there, so you'd have to check on that. But having a plan ahead of time, for example, of what to do if somebody needs a test and doesn't have a PCP. And as you can see, they went through a whole list of services that might be needed or that came up in the cases that happened in the Cathedral Square building, and how it was handled. So trying to learn from those experiences. One example that I think really highlights why this is so important is that we learned that there was a person who got mobile testing. So they had somebody come to their home and get tested, but when Sarah called the Vermont Department of Health and she called 211 to say, how did that work? I want to be able to know ahead of time how to get that if I have somebody who needs it, and nobody knew anything about it. VDH didn't know anything about it, 211 didn't know anything about it. And so with more research, including a photograph of the van that one of the Sash coordinators took that came and did it, they were able to call and get that information on how it works. So there is now a system where a primary care through UVMMC can coordinate for mobile testing. But that took several days of research for Sarah to be able to figure out how that all worked. And so if you're in the heat of a situation, having this kind of information ahead of time would be really, really valuable. And as you can see, you went through cleaning services and referrals for mental health and pet care. So certainly this can be added to and updated as you go. But and to encourage panels to work on this as you are able or as you learn of services. And I think most of the next slide is the blank template.
Yep, and I think that if this isn't already on STAR, we are going to have it on STAR. And again, I just want to say thank you so much to Ann and Sarah for doing all the legwork to make this happen. They basically took the Sash resource pool tool that had been created forever ago to talk about, who's your AAA contact, who's your designated agency contact, and they morphed that to be COVID specific. And I think that with a little bit of prep work to fill this in, it would be really that much easier should you have a case in your building to manage at the time. So thank you so much for not only thinking of it, but for making it happen. We really appreciate it.
I just want to add too on this that this is for the team. This isn't a resource for individual participants. It's a resource for the panel to have. I think there were some questions about that.
Yeah, exactly. Yep.
Okay, I just wanted to remind the Vermont nurses to complete the JOT form to request equipment for monitoring hypertension and diabetes. So you all should have received an email with a JOT form for automatic blood pressure cuffs to loan to participants, for pulse oximeters, for point of care A1C test kits, and for infrared thermometers for each panel. So at this point, I believe the Cathedral Square is going to do the ordering and then distribute them to you. So don't order anything. I know that's one of the questions on the JOT form, is whether you are willing to do that. I think for simplicity, we're going to do the ordering. But that JOT form needs to be to me by June 3rd. It's going to take, because we're doing the ordering, we want to order things in bulk. So please get those in as soon as possible. And again, this is funded through the Vermont Department of Health, so it is a Vermont-specific program. And this went to just to the wellness nurses. So please reach out to me if you don't have a wellness nurse on your panel right now, or if you check with your nurse and you want to have input on this, please reach out to me.
Great, thanks, Casey. Jessie Cudworth is a Sash coordinator down in Townsend, and she reached out to me and asked me to include the Census 2020 slide again. We talked about this back, I would say, in the beginning of May, maybe even late April, but Jessie was contacted by a local census response representative who is asking for help to reach out to Vermonters, because apparently it appears that Vermont has a really low response rate right now and could potentially not receive the appropriate funding that we need. So if you are able to reach out and help your participants complete the census, here's all the ways that you can do it. And I'm sure that, this information is nationwide, so this will work for Rhode Island and for Minnesota as well. I just know that we've heard specifically that Vermont hasn't done a fantastic job getting the census in yet. So thank you, Jessie, for sharing that information. And I will share this slide as well. Oh, so Michelle Whitney said that there are people that are still waiting to receive their paper version before doing it, and that could definitely be a part of the delay. Thanks for that, Michelle. Okay. Casey, you wanted to talk really quickly about upcoming webinars. I did forget to put the title in, but maybe Amy can tell us what the title is for the joint webinar coming up next week.
Sure, Amy, you want to jump into that first one?
Yeah, sure. I gotta open it up and find it. So if you want to move on, I'll find it and then tell you exactly what it is.
All right, thank you. And Amy can point out where these are on STAR as well, but there's a lot of really good free webinars out there right now. There's one tomorrow at 7 from UVM on the new normal, how we reopen and protect the public health, which sounds very pertinent. There's also numerous on-demand free webinars through the American Nurse Association, through the CDC, on Relias. So lots of good information out there. And certainly if you go attend one and you think it's really useful or really worthwhile, please let us know, because there's so many out there. It's not possible to kind of screen them all, but the really good ones we would like to share.
So I found it, Casey. So on June 10th, we have Erin Olikin joining us, who's the director of the Reach Up program, which is the name for the TANF program in Vermont. She's talking about scarcity and poverty, understanding poverty through a lens of scarcity and what we can do about it. So it should be fabulous and relevant no matter where you are.
Okay, thanks,
Amy. I know I'm really looking forward to it.
Yeah, me too.
So we normally end with the quote of the week. We aren't going to end with that this week. So when you see the quote of the week come up, don't get off the call. It's just that afterwards we need to have Amy become the presenter. So I've moved the quote of the week up till the almost very end, and then we'll have Amy become the presenter and walk us through STAR. But Casey and I couldn't decide on a quote of the week. So we have quotes of the week. We are all in the same storm. However, we are not all in the same boat. I heard that about 2 weeks ago, and I have to say it has sat with me nonstop since hearing it. You know, you could be in this luxury yacht over here and weathering the storm really quite well, or you could be in this dinghy and really experiencing it completely differently. And I think this really just talks to how the social determinants of health are really impactful in our experience of COVID and how we experience COVID. So as we're doing all this talk lately about social determinants of health, this one just really rang true to me. And then Casey, do you want to share your quote?
Sure, and this is again from Dr. Michael Osterholm at the Center for Disease Research and Policy. And his quote is, "We are in the second inning of a 9-inning game." So he really believes that we're at the beginning of this whole situation and it's continually evolving, which I think is helpful as we move forward. That this is, as we've said numerous times, this is a marathon. We've still got a long way to go.
Yeah, I agree, and thank you, Casey. So with that being said, and also please forgive me for the Fenway Park, I kind of felt obligated since we're in New England. But I will turn it over to Amy, and Amy is going to walk us through the STAR COVID page and just point out, I think it's really important, please hang on the call and watch, because several of the chats that have come in have been asking for a document that already exists and it can be found on STAR. So she's gonna help us figure out where.
Okay, hold on, I'm sharing the right screen. That's my pretty desktop.
I love your desktop, Amy.
Thank you.
It's
Okay.
very calming.
It is. It is. So I am going to show you guys the resources we have on STAR. I know everyone's probably got a lot going on their plates right now, just as a reminder of all of the wonderful resources that we have available. So you can access the COVID page if you go to shared resources, coronavirus, COVID-19. You'll also notice, which is really hard, and we as a STAR team have been talking about this for months, about how to fix this. I don't know if we can. When I go to coronavirus, there are 3 pop-up menus next to it, which kind of get lost because it's white on white. So the first is face masks and sanitizers, self-care during difficult times, and then help and support for Sash participants. So I don't want those to get lost, but I'm just going to go through quickly this page and then I'll show you those others. So the first thing is the Sash forms and templates. So all of the forms that we've created, the support plan, the individual plan, the phased approach, all of those things are located there. Under the handouts and resources, which are all the different handouts that you can use for participants to hang around your building. And we have additional signs below, but these are resources connected to some of the things impacting them right now. We also have the nurse vlog and check-in videos over on the right. The upcoming webinars that Casey spoke to, as well as some on-demand trainings, because some of these were recorded and then you can watch them at any time. So I encourage you to do that. And I update these webinars daily. So these are constant. Then we have handouts and resources for Sash staff. So these are some of the things for you guys in terms of what can help you do your work better. On the right here, we have additional videos. Then some of these may be helpful to show to participants or to encourage them to watch. We also have the property management resources and signs, so that stays safe as we open that Melissa just mentioned is located right here. And then I also mentioned the safely connect with friends and family sign as people are having visitors. That could also be there. So MJ asked, can we have a date pop up near the document or have the most recent documents at the top of the list? I am putting the most recent documents at the top of the list in each section. I was doing the dates and it was getting too confusing, so I stopped doing that. But thank you, MJ. Yes, but the most recent ones are located at the top. And for the Sash documents we create, we do have version numbers on them. And then we also have this video at the bottom, but there's all sorts of signs here for you guys to post around your building, so feel free. I'm gonna also go up here, go back to face masks. So people still we're asking them to wear face masks. So we do have information about resources to get them, how to make a DIY one, as well as hand sanitizer, how to make that, because I know in some places that is still scarce. If we go to the self-care during difficult times, I've also been updating this pretty frequently. So this is just a page for you guys, and you can share some of these activities and things with your participants, but they're all sorts of, I love the I'm not crying, you're crying. So these are really fun videos that kind of make you have a little soft spot. If you haven't watched the Some Good Newses, those are the bomb. There is ways to just be aware of your self-care. So the self-care wheel that I talked about during our self-care during difficult times training, that's located here. There's also stuff about exercise, art, meditation, how to give back, and then things for the kids or those young at heart. If you haven't seen the Mo Willems videos, those are also thebomb.com. Okay, and then the last page here is help and support for Sash participants. And this is one that I had heard that a lot of people didn't even know existed. So I have been putting together resources, given that we've got so many things that aren't right now, that aren't open or that aren't available or that aren't existing at the moment. So I put together this page to address some of those things. So the first section here is all nationwide support. So these are all different phone numbers, resources, websites for support that's a little bit more global that people can access. So there's stuff about foot care, housing, mental health, social isolation, substance abuse, and some stuff about stimulus checks. And then below that, I put information that is specific to each state. And I do apologize, I have more for Vermont than the other two, just because I get more of those that come through my inbox. So for instance, some people were asking about transportation in Vermont, and I said, oh, we have it right here. So there's a whole list here for transportation resources for people who have or confirmed or suspected COVID. So there's a ton here. If you have people have been sending things for me to add, if there's any changes or additional resources you know of, we are happy to add them in there. And we're doing our best to kind of keep everything up to date as things change and stay kind of on the cutting edge of the COVID information train. So if there's any questions, I don't see any other in the chat, please take a look and we'll keep updating this. And I do apologize, we've changed the layout a couple of times just because there was so information on how to split it up best. So hopefully that makes a little bit more sense as to where you can find things. Is there anything you guys would add? Oh, go ahead.
Could you just show how to do the search? Because I think that the search feature in STAR is amazing. And so if you know what the document you're looking for is, but you can't seem to find it, you could go to the search and it should pull it up for you. I just don't know.
It's so funny. Ann O'Brien just typed that exact question in the chat when you said it.
Perfect.
So the search is up here. So see, this is our Sash test account in STAR. So we have a little gnome as our picture. Just a little FYI, if you haven't put your picture in, we'd really like that. So if you click the little magnifying glass next to that, you can type in search. So let's say I want to look for, if I want to look for Some Good News, right? All of those videos I just put in there, and I click the enter button, it will, it's bringing me up to news. Maybe that wasn't the best search. It's bringing up every time there's news. So here's the Some Good News page, right? So you can see it'll highlight the word or one of the words that you've done a search for, and then you can click on that and it'll bring you right to that page where it's located and it's highlighted. So it makes it really easy to find. The search feature in STAR is pretty wonderful.
So Jody, if we would be willing to add the Tech Education for Elders video, audio telehealth from Dartmouth. Sure, Jody, if you can just send it to Amy or to the Sash inbox.
She did. I haven't added it yet. Yes, I was checking with Dartmouth. So for those of you who don't know, Dartmouth has a guess it's like a support for older adults with tech issues. It's fabulous. And I wanted to check first with Laura to make sure it was open to our entire state. And she said it is. And I think it may also be open to other states. So Providence and Minnesota, you guys may also be able to benefit from this. So I will be posting that, Jody. So thank you. But yes, it is in the works. I was checking first to make sure it would be okay before they got an inundation of Vermonters looking for help.
You're so thorough. I would have just thrown it up there. So thank you for thinking to check. I appreciate that. It looks like we have gone through our content and I don't see any other questions coming in. So that's our call for today, everyone. Thank you so much for all that you're doing. If you have other questions, please feel free to reach out to us and we will be following up with an email that's going to have apparently a ton of links to some really great resources. And then an email will come out next week for our in-between, and then we will talk with you all again in 2 weeks. And it'll be interesting to see where we're at then. But again, just thank you, and everyone be safe and stay well.